Hello, my name is Adam Kirking. I'm a Director of Operations with Imperium Health, and I'm excited to be here with you today to talk a little bit about transitional care management and how to develop a program that will help to reduce readmissions as well as increase revenue for your practice. Today we're going to review the transitional care management and kind of build off some of the components that we discussed during our earlier TCM webinar. We're going to talk about the importance of education and really promoting TCM to both those internal stakeholders that are going to be your providers, your clinical team members, your manager, as well as your registration team, as well as your external stakeholders like the patient, the hospital, the skilled nursing facility, and the home health agency. We're going to talk a little bit about discharge notifications and how to get a couple more than you're maybe receiving today, as well as how to identify those that you should be receiving them from. We're going to talk about the interactive contact and the key components that we need to make sure that we're covering on that to ensure that we're complying with the TCM regulation, the in-person visit, and the things that need to be covered as part of that to not only satisfy the TCM visit, but also to help to make sure that we're meeting that Medicare shared savings MedRec within 30 days of discharge quality measure. How to make sure that we're billing for these TCM visits effectively so that you can capture the revenue that you deserve. And then a few other observations and recommendations that Imperium has had based on working with multiple practices throughout the country. So to get started, TCM really is that post-hospitalization, post-inpatient visit where you're trying to see the patient within the clinic in the first couple days post-discharge. This is one of the things that when we looked at all of our Imperium discharges, we were most able to correlate with helping to reduce readmissions. Because a readmission is an inconvenience, it's a part of someone's life that we hope they never have to go through. So if we can implement a really strong TCM program or execute those TCM visits complete with that interactive contact, we're able to best meet the needs for our patients. So one of the reasons why I love to promote the TCM visit and then establishing a TCM program for yourself is it's the idea that it helps to sticky that relationship between you and your patients. The more you can connect between you and your patients, the more you're going to be able to help to influence and positively direct them to really high value care. Educating your patients around where to go to following a hospitalization can make sure that you are their go-to resource for any questions. When we looked at all of our Imperium discharges, and that was over 100,000 discharges in the last year and a half, it was one of the most important things for helping to reduce readmissions and drive positive outcomes. As well as it's a really successful visit for helping to drive your own clinic revenue and potentially for identifying patients that could be a great fit for the chronic care management program. Now, when I'm thinking about TCM visits, and this is going to build off that earlier discussion we had where we talked about TCM, you can really do it or think about your TCM program in about 5 steps. We want to make sure that when that patient is discharged from a post-acute or from a hospital, that we're bringing them back into the clinic. We want to make sure that we are contacting the patient within those first 2 business days of discharge. We want to make sure that we're doing the face-to-face in the first 7 or 14 calendar days. We always want to make sure that we're billing for it correctly. And then I'm always somebody that likes to measure and always try to work to be a little bit better. So monitoring our performance and making any adjustments that we need to make sure that we're able to maximize our workflows, as well as potentially re-engaging some hospitals, re-engaging some post-acute facilities, because we might have been initially receiving discharge notifications, but if there was a break somewhere in the system, or we feel like that's the next opportunity for ourselves, we always want to make sure that we're able to close the loop with our patients by getting the most information available to us. So again, when I'm thinking about TCM and transitional care management, one of the most important things for me is our ability to promote it and educate those around us about the importance of the visit. Because if we have in our head the perfect workflow designed for ourselves, but we're not able to educate either clinical team members, the patient, or those that should be helping to provide us with discharge notifications about the importance of the TCM visit, it's going to be pretty tough to really maximize our efforts and give our patients the care that they deserve. So education and positively promoting the TCM visit are one of the best things we can do. So as I think about promoting TCM visits, it's really going to be about internal stakeholders as well as external stakeholders. Because my internal stakeholders that I'm most concerned about, I want to make sure that the provider understands the importance of the visit. Anything that can be messages coming from the doctor, coming from the nurse practitioner, coming from the PA, the more it can be messaged coming from your provider, and having the provider buy into it and say, this is important to me, the more effective the visit will be with the patient. We also want to make sure that the clinical team members that are going to be spending probably the most time with the patient, those likely doing the interactive contact, understand the importance of the visit and know how to really promote the visit to the patient. Because if we have a patient that we complete the interactive contact with that says, you know what, I'm not quite sure if I want to come in, that's that opportunity for the clinical team member making that phone call to really emphasize the importance of getting the key information about the patient, closing any potential gaps in care, and reestablishing services in the clinic itself. We want to make sure that our leaders understand the TCM visit. Oftentimes, the leaders are the ones that are going to have to oversee the entire program to make sure that we're maximizing our work and maximizing our effort. But the leadership may also be the ones that will have to reach out to some external stakeholders, like a hospital CEO, maybe like a hospital discharge planner, maybe that skilled nursing facility DOO, the one that's going to help to make sure that we're able to receive those discharge notifications and best coordinate the care for our patients. And now when I put support team down here, what I really mean by that is the registration team members, the billers, the schedulers, those that have non-clinical but really essential ways of touching and supporting the TCM process. The work that they do is just as important as that provider, just as important as the leader, and just as important as that clinical team member. Because if things don't go quite as well as they could have during the registration process, during the scheduling component, or during that billing, now we might have done all of the other steps correctly, but we won't get credit for what we deserve. And then the better we can communicate with our external stakeholders, the easier it's going to be for the program to really stick and flourish. So that communication with the patient to make sure that the patient understands the importance of coming back into the clinic, having those really good discussions related to discharge instructions, and making sure that we understand the medications that we're supposed to be taking makes such a difference in terms of helping to reduce readmissions and helping that patient to thrive while they're at home. Our local hospitals make such a difference in terms of making or breaking a transitional care management program. Now, there are some other components that may help getting discharge notifications, like a state HIE, but one of the most important things you can do is best engage your local hospital so that they can send those discharge notifications to you directly. Or maybe even start to think about how can we notify the providers or notify those primary care providers before the patient is even discharged, so that the clinic can start to prepare and get a game plan for how can we best support this patient. Now, about 20 to 30% of patients will oftentimes go to some level of a post-acute facility when they're discharged from the hospital. And that could be a skilled nursing facility, a long-term acute care, or sometimes an inpatient rehab facility. And when a patient goes to one of these facilities, it's important that they also understand the importance of trying to bring the patient back into the clinic and really coordinating that care before the patient goes home or as the patient is going home. In home health agencies, although kind of a weird way that they can tie into this, may find out about a discharge notification before the clinic. So as I'm thinking about my preferred or my best home health partners that I want to be having, it's the ones that are going to be able to reach out to me as a primary care provider just to make sure that I know, even if I'm not the one that ordered home health or if I wasn't the discharging provider, that my patient that I'm normally treating was just discharged from the hospital. Because that's one other potential way of connecting with the patient and potentially bringing them back into the clinic. So again, as I'm thinking about educating those internal stakeholders and those internal team members, everybody plays a slightly different role. Because the manager is going to be important for making sure that they're supporting overall process improvement, as well as potentially reaching out to some of those post-acute facilities and hospitals to make sure that we're improving our discharge notifications. The nurse and the MA who's doing that interactive contact, they really need to have an understanding of the importance of the discharge process and the importance of trying to bring the patient back into the clinic. They're the ones that might serve as really kind of the salesman for the process for the patient, and the better they can understand the importance of the TCM visit, the more likely the patient is to show up for their clinic or that face-to-face visit. The billers and coders must understand the 2 codes associated with the visit, as well as when to use those codes and not to mix them up with a 99213, 99214, 99215. That 99495, 99496 are so important, pay a little bit better, have a little bit higher RVUs, and are what the providers deserve to be paid if that's the service that was provided. Now, with registration and scheduling, one of the things that we've really started to identify is they have the opportunity to redirect a patient back to the clinic if the patient's potentially going to cancel or no-show. If a really on top of it, registration team member, that person sitting at the front desk, identifies that we have a TCM visit that just canceled on day 5. Well, let's get that patient rescheduled for day 7 or day 10. If we had a no-show on day 5, let's get that patient rescheduled for day 7 or day 10. Or better yet, if they no-showed, let's make sure we reach out to the patient right away to make sure that they're doing okay. And that front desk person has such a key role of helping to really promote and sell the patient on the importance of the TCM visit. And when I say sell the visit, I mean helping to educate the patient around the importance of why they're there. Because the more we can educate each individual patient, the easier it's going to be for those patients to then tell their loved ones, their friends, the importance of going back to the clinic after they're discharged from any sort of an inpatient facility. And then the providers understanding the importance of doing the visit really ties everything together. Often everyone beats to the drum of the providers. And the more engaged your providers are with the TCM visit and the TCM process, the more likely it's going to be that you're going to be able to get your MAs on board, that your schedulers and your registration team is going to understand the importance of the visit. And they're going to be paying attention because they're going to make sure that their billers and their coders are doing everything correctly because they understand the importance of doing the visit, but they likely also understand the RVU or potential revenue opportunity associated with doing these visits correctly. And I would say the more often you can discuss through team meetings, huddles, the importance of TCM visits, the easier it's going to be to get things to stick. And never forget that a new team member might not always have the same understanding or same baseline knowledge as it comes to TCM visits as some of your more seasoned team members. And as we are always introducing new topics, reminding folks of the key components or those team members of the key components is so important because you may have different reps, different insurance companies coming in promoting things slightly different. But the more we can really tie it back to those core visit principles, the easier it's going to be to get your TCM visit to stick and be as successful as possible. And as I'm starting to think about external communication, the most important person we can communicate to externally is the patient. And the idea of how we're phrasing things when we're communicating with the patient makes such a difference. You know, a couple key things that have stood out to us as Imperium as we've started to promote these is the idea of saying your provider versus the clinic. So for instance, Dr. Smith would really like you to come back in for your post-hospitalization follow-up visit. Now that's going to probably sound a little bit better to a patient than, I'm Adam, I'm calling from the clinic. We'd like you to come in for your TCM visit. That's a lot of things that first off the patient probably didn't understand, and having everything tied back to the provider will oftentimes help to kind of perk that patient up or go, oh shoot, Dr. Smith thought this was a big deal. I really better make sure that I go. And another key component that is associated with the TCM visit as well as that Medicare Shared Savings Quality Measure is we have to do a med rec, but how we explain that to the patient makes such a difference in terms of how effective it is or the patient's perception of it, because too often perception is reality to our patients. So it's from my experience, it's always important to say we want to make sure that we have complete information. We have the best information about you, as opposed to we want to do a medication reconciliation. Most people will not necessarily know what a medication reconciliation is. And if they do, they might not understand that we're also talking about your aspirin, your vitamin D pills, every component or every different thing that you might be taking. We need to be kind of cueing in on that. A few other keywords that we've identified that can be really effective is we're going to review your information. We want to make sure that we have the best information for the provider. We want to make sure that you have what you need. And that you have what you need component is so important as we're starting to think about patients going home from the hospital. If they were at a skilled nursing or some level of a post-acute facility, it might be a month since the last time they were at home. We really need to make sure that that patient has what they need. And not only do they have what they need, but they have what they need to keep that patient happy, well, and out of the hospital. A readmission is expensive, but more importantly, a readmission is time away from other things that people would rather be doing. Time that the patient's family members do not want to have to spend going to the hospital. Time that the patient doesn't want to have to spend being inconvenienced by being in a hospital. The more we can keep that patient happy and healthy out of the hospital, the more successful our ACO as well as our practices are going to be. And then when we're starting to think about communicating with different community facilities, that makes such a difference in terms of taking that TCM program and going from kind of above average, maybe doing 10 to 30%, to starting to think about going to 40 or 50% of our patients being seen for appropriate TCM visits. So as I'm thinking about how to message this to community partners, one of the things you can talk about is an improved partnership. Because the better that we're collaborating, the more that we're communicating amongst ourselves, the easier it's going to be for you to be my preferred partner. When a patient tells me, where should I go? I'm going to tell them to go to you. And how I would typically say that is, I need you to go to this community facility because if you go there, they're going to let me know. If you go to a different place, they're probably not going to let me know. Now, because we've really ingrained that TCM visit as well as the well visit with our patients, we know that our patients are going to look to us as the real kind of source of truth and knowledge of what's the best place in the community to receive care. So that patient-directed visit or that patient-directed post-acute stay makes such a difference when coming from the provider. Now, obviously, one of the main goals of any care setting, but especially a transitional care management visit, is that continuity of care. So as I'm messaging and communicating why I need to be receiving discharge notifications to a community partner or the importance of a TCM visit, I'm going to talk about continuity of care. Because I know that it's very hard for us to provide that care that our patients deserve if we don't know about it. So communication is one of the best things that we can do to help make sure that we're giving our patients, the whole reason why we're in this profession together, we're giving our patients what they deserve. And some organizations may not be quite as motivated by those first two components. And if they're not, likely something that will help to motivate them is the potential readmission penalty associated with readmissions or returns to the unplanned returns back to the hospital. TCM visits are one of the most effective ways to reduce readmissions. That multiple time engagement with the patient, those multiple touch points are one of the best ways to help to reduce readmissions. And as I'm thinking about communicating with post-acute facilities, and sometimes even selling your community hospital, selling your community skilled nursing facility on, come on, please just give me those discharge notifications. If the continuity of care, if that idea of being a preferred partner, if that doesn't sell them, bring up the idea of, you're going to probably have readmission penalties if you don't start sending us better discharge notifications. Because if we don't know about it, we have a hard time helping that patient to stay as healthy and be as successful as they can be. Promote that readmission penalty only when necessary, but for some community partners or potential community partners, it does help. So as I'm then thinking about, okay, now we have our preferred partners. How do we make sure that we're getting our discharge notifications? So the first step I would usually think about is, does the clinic receive any discharge notifications today? And then have they ever? And then as I go through my own list of community partners, what facilities are my patients most likely going to? And you can use ACO Health Solutions to help with that as well. And who should I be receiving discharge notifications from? Because hopefully we're receiving discharge notifications from all of those community partners. But it is easier to sometimes miss a couple of those post-acute or inpatient rehab facilities that our patients are also pretty likely to use as well. The more discharge notifications we can be aware of as a primary care team or as a patient-centered team, the more successful we can be in helping to better coordinate the care for our patients. And sometimes it's important to take a pretty proactive approach to making sure that we're able to get those discharge notifications. One that I always promote is let's make sure that we tell our patients to call us. Now, hopefully when they call us, they can provide us a little bit of the key information like where did they go, about when, to make sure that we're able to get some of that post-discharge or those discharge instructions information for ourselves. But at the very least, the fact that they told us makes it easier for us to better coordinate their care. And the other approach that I will usually promote is, and this is a form within your TCM toolkit, is to proactively contact your most used facilities and ask for discharge notifications. This works sometimes. It doesn't always work, but it can be one of the best ways to make sure that we're proactively reaching out to our facilities, because they may have a wrong fax number because of an EMR upgrade that they did. And one of the other tips for success that I have is always promote TCMs in just about any visit, but especially as part of your well visit as well. So during a well visit, it's a chance to have that conversation with the patient about past history, past experiences, and then promote, if you do go back to the hospital again, something that we've started doing here that has been really effective at reducing readmissions is trying to have you come back into the clinic kind of right away. So the more we can promote that to our patients, the easier it's going to be to help have that patient-directed communication back to us. And the interactive contact is oftentimes that first time where we can have that patient either reach out to us or we reach out to them. The interactive contact can be the most essential and most challenging if you're not getting the discharge notifications, but it can also be the most important at helping to reduce the readmission. This is that kind of brief contact, usually by phone. It can be by a portal or by email as well, and it can be face-to-face as well between the patient and a clinical team member of their provider's clinic. So kind of the who, what, why, and when. The interactive contact should be made by a clinical team member. So we will usually promote LPN, RN, educators, MAs, or pharmacy techs as the person making that initial contact. One of the reasons why we include pharmacy techs in that is because you might be including questions related to medications prescribed as part of the discharge or even discharge instructions. And then it really is that opportunity to kind of resell or re-engage the patient on the importance of the face-to-face visit. That interactive contact is so important because contacting the patient within the first few days is one of the best ways to help to reduce a readmission, make sure that the patient is actually doing as well at home as they first thought they would. And it is one of the required components. And you need to do that interactive contact within the first 2 business days following the discharge. So as a reminder, weekend days and holidays do not count. And the actual discharge day itself does not count as one of those 2 business days. Now, when you're documenting your interactive contact, we have a template that we promote and say, these are great things to capture. Now, and if you have an opportunity to enter something within your EMR and create like a telephone encounter, I definitely promote that as one of the best ways to capture information. Always make sure that you're documenting the who tried to make the contact, when, and the mode, because the most important thing is that you do 2 documented attempts within those first 2 business days. That's important because we may try on Monday and Tuesday, not reach the patient either day, but we're able to reach the patient on Wednesday or Thursday. Now, the Wednesday or Thursday contact doesn't necessarily matter for the TCM, although it does help to make sure that we're able to contact the patient to ensure they're doing okay. And hopefully by contacting the patient on Wednesday or Thursday, or in that scenario, days 3 and 4, we're able to get them to come back into the clinic on days 4 or 5 to do that within 7 days TCM visit. The most important thing you can do with this is document what you talked about and document who made that call. No one wants to be audited and feel like they're scrambling to find information. So the better we can document information for ourselves, the better prepared we'll be for an audit, and the more we're able to take advantage of that communication with the patient and share that information back to other team members. This doesn't need to be the most thorough call in the world, but it does need to be making sure that the patient is doing okay, potentially answering any questions that they may have. And I always use the interactive contact as a way to remind the patient, bring your medications back into the clinic for your face-to-face visit. Bring your discharge instructions back into the clinic for your face-to-face visit. Those are great ways to make sure that we're able to close the loop and provide the best education for our patients possible. Now, the interactive contact should have pretty standardized workflows. I say this because without a standardized workflow, it's easy to have variation either in what's communicated, who's making the call, or the messaging to the patient around how quickly we have to get you back into the clinic. And from my experience, sometimes assigning a team member to make the call can be really effective at helping to ensure that it's never missed. Usually this is going to be either one person that does it for the whole clinic, or somebody within each pod or for each provider that makes that call. Sometimes doing a medication reconciliation as part of the interactive contact can be helpful, although we will typically promote doing that med rec as part of the face-to-face visit as well. And I always use the face-to-face or the interactive contact as an opportunity to not only promote but plan for the face-to-face. Encourage the patients to bring in the right information. Encourage the patients, if you have any questions, please let us know now. Please make sure you contact us well before if anything changes or anything goes wrong. We want to make sure that the patient's doing the best they can and really thriving at home. So when I'm scheduling my TCM visits, one of the most important things that I always want to keep in mind is it's sometimes important to make sure that we're distinguishing how these are scheduled, how these are documented. Because if a patient cancels or no-shows, we want to make sure that we know that this was potentially a TCM visit, not just a 6-month or a 3-month medication refill visit. We want to make sure that we're always capturing the right information for those TCM scheduled visits so that if they need to be rescheduled or we need to check in on the patient to make sure they're doing okay, we kind of have that internal flag for ourselves. So when I'm scheduling my face-to-face visit, engaging the patient, really promoting it is one of the best ways that we can make sure that the patients are a little bit more likely to show up. Rescheduling those cancellations, educating the schedulers around the importance of all team members or bringing that patient back into the clinic, it makes such a difference. Sometimes you want to identify like a TCM champion almost, as that person that can help to make sure that our patients are being scheduled and we're not missing any opportunities. And I have seen some groups that will use some sort of a triage, whether they have a clinical team member that says this is more likely to be a day 6 versus a day 10 patient. Or, let's treat every patient as though they may be a day 5 patient. And we will identify once we bring them into the clinic whether or not it was really more of a 99215 or 99495 or 99496. And that face-to-face encounter, that's an opportunity for the providers and for the care team to lay eyes on the patient. And in my opinion, one of the best things you can do is to kind of be in front of the patient and not only promote the connection that you're having with them and trying to help them to be as successful as possible, but also documenting, how does the patient look on a given day? How does the patient sound on a given day? We want to make sure that we're staying on top of those things just in case the patient does happen to get a little bit worse. The face-to-face kind of key things that I always want to make sure I'm documenting, we're going to review any of those discharge instructions. We're going to review any additional referrals, things like that need to be followed up on. We're going to answer any patient questions. And we may need to do almost like a follow-up plan for the patient to make sure that they're able to be as successful as possible. And to satisfy the ACO quality measure, so this is going to be a little bit different than how you may normally document a med rec. We need to always make sure we're documenting the patient did or did not receive discharge medications or new medications. And then we reconciled the current medications or what we have based in our clinic with the discharge medicines or the medications that a patient may be left the hospital with. We need to make sure that we're documenting that we've reconciled those two things. We need to do that to make sure that we're helping to satisfy that Medicare shared savings quality measure. As well as it's just important to make sure that we are going through the steps to validate, did you get any new medicines? Did you get anything else? Are you sure? And validating that with anything the patient was previously taking to ensure that we have the best information in our own medical record, because we want to make sure that we have the right information to, if it's a specialist referral out, if it's a imaging, whatever it may be, we have the right information to best help that patient. As I'm thinking about scheduling that face-to-face visit, it is sometimes important to do a little bit of triage. You always want to plan for future face-to-face visits, because sometimes it's important to think that patients in for on day 5, day 6, but you know what? We'd like to have them come back in 2 weeks for another visit. And there are some things that you can provide as part of a TCM visit that are just kind of expected, but you don't have to do. You're not able to bill for these separately. Things like additional education that may be provided, interacting with other team members, such as maybe a specialist or the hospital. These are things that are kind of an expectation, but you don't necessarily have to do them, and you cannot bill for them extra. So when I'm bringing that patient back into the clinic for my face-to-face visit, one of the things that I always want to make sure that I'm prioritizing is, do I have any patients that are maybe a little bit higher risk? And if they are, how can I provide them a little bit of extra care that they need to help them to be as successful as possible and thrive while they're at home? And this form that's in the TCM toolkit is going to be one of the great ways to maybe keep track of our patients, follow up on them, and potentially prepare them to enter like a chronic care management program as well. So this is just a template that we have, not one that you have to use, but one that we found to be pretty successful for us. So as I'm thinking about billing TCM, one of the things that always stands out to me is a TCM visit is slightly different than that post-hospitalization E&M, likely a 99213, 214, 215. And it's okay to bill a post-hospitalization E&M. If you didn't meet the medical complexity requirements, if you didn't do the 2 business day interactive contact, it's okay to bill for a TCM visit, or to bill for an E&M visit. Now, if the patient was at a high or moderate complexity decision making, you did that interactive contact within the first 2 business days, and you saw the patient in the first 7 or 14 days, absolutely bill it as a 99495 or 99496 and get the reimbursement that you deserve. But I do like to always kind of pause here and say, not every post-hospitalization, post-inpatient, or post-observation stay will really qualify as that true TCM. And one of the biggest drivers is going to be, if you bring a patient back into the clinic and they're really not as sick, not as medically complex as we first expected, you should probably bill for it as an E&M visit just to be a little bit safer. Nobody wants to be audited and have CMS identify something that we might have to potentially pay back. So it's always better to be a little bit conservative while still understanding the rules. And those 2 TCM visit types is, one is the 99496, and that's the visit within 7 days, or 99495, which is the visit within 14 days. The biggest difference between those 2 visits when it gets time for billing is not only the timing, but also the decision making of the patient. So as I'm thinking about a 99496, it's often more comparable to a 99215 in terms of its documentation requirements. And that's really going to be one of the biggest drivers of differentiating the 2. Because if you see both patients, or if you see a patient on day 5, but one is a little bit more medically complex and one is pretty moderate, you should build the more medically complex, or that high complexity patient, as the 496 code, and the moderate level complexity patient as a 99495, even though they both might have been in less than 7 days. Now, one of the challenges of a TCM visit is that it's kind of like a clinic bundle. Now, it's not really quite like that, but it's essentially you're expected to provide some level of care or support for that patient for the 30 days following the admission, or following the discharge. And as part of this, you cannot bill for care plan oversight, home health or hospice supervision, some ESRD services, and chronic care management. So those are things that you cannot bill for while the patient is receiving the TCM, or as part of that post-hospitalization, that 30-day period after they leave the hospital. And if you're a surgeon, it's pretty rare that you'd actually be able to bill for a TCM visit. Now, if you do a surgery, it's possible for another provider to bill for the TCM visit, but for a surgeon or a proceduralist, it's usually considered part of a global period and you can't bill for an extra service. Now, if you bill for an E&M service on a separate day, it's usually considered acceptable, and it's almost always considered acceptable as long as it's medically appropriate. And that extra clinic visit is one of the best ways to make sure that our patients are doing okay and getting the care that they deserve while they're at home. So monitoring performance, communicating expectations, and really evaluating to see how we're doing is one of the best ways to take that program and going from a couple of visits here and there to really maximizing it and understanding how important it is. So as I'm doing TCM visits and thinking about my TCM program, my goal is to usually have at least 40% of eligible discharges receive a TCM visit. We know this is important because setting goals increases your awareness. Just simply setting a goal increases your awareness. And communicating that goal helps to raise expectations for everyone within the organization. And you're going to do this by either pulling information from your EMR or your billing system to check, how often are we actually billing for those 99495, 99496 codes. And that's a great way to get a week over week just kind of check of how many are we doing. And then you can use ACOL solutions to help get not only how many did you do, how many were potentially eligible to be done. And identifying that denominator number of how many could we have done or how many potentially should we have done. And that's one of the best ways to monitor our performance over time. I will always say auditing your claims is one of the best things you can do, just to make sure that if you billed for it, was it paid as timely? Was it paid the way you expected it to be? Monitoring on a weekly basis how many of these we do makes such a difference. And I mentioned at the start, as we were thinking about education, promoting performance to your providers, to your clinical team members, not only of the importance of the TCM visit, but how are we doing, makes such a difference. It can help to drive that internal internal challenges, internal competitions to make everybody just a little bit better. So as I'm then thinking about how do I take my TCM program and go from just sort of starting up to being at a really high functioning level, I want to take not only that quiz on the left, but the quiz on the right to make sure that I'm being as effective as I can with my TCM program and doing everything in my power to really support my patients to be as happy and as healthy as possible. Thank you very much for your time today. I definitely appreciate it. Definitely appreciate you going out of your way to develop a TCM program or maintain a TCM program that'll help to give better outcomes for your patients. I hope you have a great day, and I look forward to our next webinar together.